The Mucopolysaccharidoses, or MPS disorders, are a group of lysosomal storage disorders that have in common an accumulation of glycosaminoglycans. However, they're due to distinct enzyme deficiencies within each category. There's MPS 1, 2, 3, 4A, 4B, and MPS 4, 6, and MPS 7. There are several types of MPS, and they are all distinct enzymatic deficiencies that lead to accumulation of glycosaminoglycans. Common early features of MPS disorders in general include a range of coarsening of the facial features that are characterized by frontal bossing, prominent mouth, macroglossia, so an enlarged tongue. They also present with recurrent ear infections, sometimes requiring laryngotomy tubes. So they might be seen by an ear, nose, throat doctor, an otolaryngologist first for recurrent ear infections. And their coarse facial features in certain types are not so prominent in the first few years of life, but as the gags accumulate, they might become more prominent. And so early diagnosis is critical because this is a multisystemic disorder leading to dysfunction in the heart, the lungs, the bones, the cartilage, and in certain forms, the brain. And with early intervention, we can start to decrease that accumulation of gags throughout the body and hopefully prevent the progression that we see in these diseases. They all are progressive over the lifetime and leading to an early death in many cases. There are slower progressors and more fast progressors, and we sometimes can't tell at first what group they might be in. And so fortunately, for several of the disorders, we do have an FDA-approved therapy for MPS 1, for 2, for MPS 4A, 6, and now MPS 7. There's the specific recombinant enzyme that is given back through an intravenous infusion every 1 or 2 weeks, depending on the enzyme. And this has been life-saving. We have seen, for instance, for MPS 6, the data after over 10 years on being on therapy have reduced the morbidity and mortality associated with MPS 6 by administration of IV naglazyme. Vimizin, which is the drug for MPS 4A, has been out for several years now, and again we are following long-term to see how we can prevent or slow down the progression of the disease. MPS 7 SLY syndrome has the recombinant beta-glucuronidase enzyme called Mepsevii, and that was approved just in the last 2 years. So we will see how that helps prevent the progression of the disease.